workshop coming up. But I want to thank Cindy Domingo, Jan Strout, who I don't think is in the room, the U.S. Women and Cuba collaboration, and the Women's International League for Peace and Freedom for hosting this. As Cindy said, my name is Bob Schwartz. I'm the Executive Director of Global Health Partners. We've been working with Cuba's Ministry of Health for more than 3 decades. And we're one of the largest donors of medicines and medical supplies globally. We've donated more than $275 million worth of material aid. Now, as we've heard this morning, as we've heard from Osmaida, Yamila, Maybel, and all the others, the situation in Cuba today is a crisis of monumental proportions. And it should be concerning to all who love and support Cuba. The embargo impacts virtually every aspect of daily life in Cuba. The lack of fuel, as we're hearing today, extensive daily power outages, the cost of food, a public transportation sector that has literally been stopped in its tracks. But I believe the greatest impact of all has been on the public health sector. That's where you're really seeing the life and death impact of the new sanctions. I began working with Cuba right after the collapse of the Soviet Union. At that time, Cuba's health sector was literally on life support, if you can imagine that. And some of you have been there during that period. The lack of essential medicines, antibiotics, analgesics, asthma inhalers, insulin. If you can imagine, Cuba was recycling disposable gloves and syringes. Hard to imagine. One of the most devastating examples that demonstrates how U.S. sanctions have negatively impacted Cuba's health sector has been the infant mortality rate. I want to make sure I get these numbers right. Before the revolution, before 1959, the rate was approximately 70 deaths per 1,000 live births. That's how you count an infant mortality rate. And I believe that that number was almost certainly an undercount because many people in rural areas never got to see doctors. Babies died without ever being reported. So that 70 number is kind of fungible. The revolution changed all of that. Cuba, over decades, built a public health system that was the envy of the developing world. The infant mortality rate, when I started working with Cuba, had dropped to 5.2. For context, that's comparable to many major developed world cities. It's certainly better than some of the cities in the United States. Today, as a result of the sanctions, the lack of hospital equipment, a nutritional deficit, migration of public health doctors and nurses out of the country, that number has increased to 9. You can imagine that. And that's almost certainly going to go higher as conditions worsen. There's no two ways about it. So Global Health Partners donates roughly $4 million worth of meds and medical supplies annually. Many of you are probably familiar with some of the high-impact campaigns that we've done. And I'm going to give you a couple of stories because I think it really works to what we're discussing today. During the pandemic, you might remember, Cuba developed 2 vaccines that had the same efficacy as our Moderna and Pfizer vaccines. While most of the planet was desperate for vaccine, Cuba had vaccine. But what they didn't have were syringes. Right. If you can believe that. And every city, every state, every country was looking for the exact same syringe. Cuba came to us and we responded. We donated more than 6 million syringes to Cuba for their COVID vaccination program. We saved countless lives. We helped Cuba to vaccinate their entire population, and we reopened the country. That was an incredible feat by the global solidarity movement. And I think it speaks to what we're dealing with today. More recently, Cuba launched a campaign to donate pacemakers. Global Health Partners took that on. There's a 3-year waiting list, if you can believe that, for people that require pacemakers. And you don't last long on a pacemaker waiting list. I mean, to be real, there's very few people that are on a list for 3 years. There's constantly people dying, constantly people being added to the list. So, Global Health Partners searched around. None of the US companies would provide pacemakers to Cuba. There are 3 major companies. They represent more than 80% of the pacemaker and the cardiac market globally. Medtronic, Abbott, and Boston Scientific. None of them would supply pacemakers for Cuba. So we found a pacemaker company that Cuba's familiar with, and we ended up purchasing, not donating, but purchasing pacemakers for Cuba. And we have saved 960 lives in that 1 year period. And last year, last month, GHP donated $60,000 worth of sutures to Cuba. There's a shortage of sutures in the country. Surgeries are being postponed or canceled because of the lack of suture. Now, I've highlighted those 3 examples for a reason. There's nothing really special about syringes, pacemakers, sutures. You can see them in any hospital in the United States or around the world. You can buy them on the internet. But I think Yamila was just speaking about this. The Cubans are unable to buy a lot of this life-saving equipment because of the sanctions, the SSOT regulations. They can't do banking the way normal countries and institutions do. So they're left struggling for basics that we take for granted. Now, how does that relate to neonatal and maternal health? I want to get back to that for a second. Global Health Partners has spent the last 2 years developing a neonatal and maternal health care initiative with the Ministry of Health. It hasn't been easy. The economic crisis, you might recall the hurricane, the reconstruction efforts on the eastern part of the island, the chikungunya epidemic have all contributed to making that work all the more complicated. We've agreed to fund and to support a pilot project that's going to initially be launched in 2 hospitals in Havana. Originally, we were going to do a hospital in Havana, a hospital in the eastern part of the island. But due to the fuel crisis, we've now got 2 hospitals in Havana. And that's the, let me get it right, the Ramon Gonzalez Coro Hospital and the Diez de Octubre Hospital. It's a maternal hospital. These 2 hospitals attend to the most complicated pregnancy and neonatal cases. The Gonzalez Coro Hospital also provides specialized care for infants born to mothers with diabetes or heart disease. So if there were no US embargo against Cuba, the highly skilled medical professionals at these facilities would have access to modern technologies and drugs and equipment needed to save lives. But the embargo prevents Cuba, again, from sourcing the equipment, from buying the equipment, or from getting spare parts. For example, there are incubators and ventilators that are sitting on shelves because they can't get replacement parts anywhere in the world. If they bought a GE incubator, for example, in Germany, they can't get replacement parts for that. So our neonatal and maternal care initiative has 2 priorities. First, we're going to deliver scarce medical equipment, medicines, disposable sterile materials, and diagnostic tests. These resources are going to enable the hospitals to provide comprehensive, high-quality care for pregnant women at risk for hypertension, hemorrhage, preterm delivery, as well as for the increasing number of infants born with low weight. Our second priority is to strengthen prenatal care at local primary care clinics and neighborhood doctors by offering specialized training, resources, improved monitoring, education, and nutrition during pregnancy will also reduce the infant mortality rate. Now, what does that mean for all of us in real terms? Because I want to turn this kind of into an action meeting. Over the first year, we're going to spend about $360,000. And we're going to equip hospitals with newborn ventilators, newborn incubators, fetal heart monitors, portable X-ray equipment, and state-of-the-art ultrasound equipment. Obviously, we're going to have to provide medicines, reagents, and disposables, because those are all in short supply. Our goal is to provide Cuba with the life-saving resources to restore and better its infant mortality rate. If this pilot project is successful in Havana, we're prepared to scale it over the next 5 years for the rest of the country. And their Ministry of Health has a plan for that. So I think I'm going to stop here. I know you're short time, and you want to speak your half time. So I think I'll stop here and turn it over to Cindy in the U.S.-Cuba Women's Collaborative, and you can take over. Thanks.
Thank you. So thank you for coming, and I wanted to, Lenny did not identify herself, and she's an important part of this campaign. Lenny Villagomez-Reeves is a retired doctor, and is also the co-chair of the Women's International League for Peace and Freedoms, Cuba and the Bolivarian Issues Committee. And so she's a very important part of this campaign. And I am Cindy Domingo, the co-chair with Lenny, but also the chair of U.S. Women in Cuba Collaboration. So we are entering into partnership with Bob's organization, because we have spent, since 2003, when U.S. Women in Cuba Collaboration was founded, have spent it's 2 decades, over 2 decades now, building a strong U.S. women's movement here to lift the blockade, but also to build relations between women's movements, LGBTQI movements here in the United States with people in Cuba. And so we think this campaign falls right within both our organizations' realm of work, because we have focused on women's issues and children's issues. And so we are hoping, once this campaign gets off the ground, that you will join us, because it's not just about donating money, it's about educating people about the impact of the blockade, about the impact especially of the economic blockade and the oil embargo now occurring, and that Cuba has shown us that that women have all human rights, that the Federation of Cuban Women have fought for that agenda since the revolution was won, and that we, as women, LGBT people, all people deserve those types of rights here in the United States. As if Catherine Trujillo Hall was here, she would tell you Cuba has figured out how to save the lives of black and brown babies. That if Cuba did not have U.S. imperialism's foot on their neck, brown and black babies and all babies would be thriving in their society. But now they are even suffering more. So we want you to join us in our education campaign, join us in raising money, join us, we're hoping to do a delegation of mainly women, but if some men want to join us and they want to work on the campaign, we welcome that. We've always welcomed anyone who wants to work for the rights of the people that we're working for. So we're hoping to do a delegation in the fall to really build a core around this campaign, a national campaign that we can all focus on, because we know that once we focus on a particular campaign, as Bob has talked about the other campaigns they have done, that we can accomplish what we set out to do. So you can donate money now to Global Health Partners at ghpartners.org, as well as keep looking at their website for updates on this campaign, as well as our website, womenincuba.org. Our website might be a little bit slower to catch up, but we're all an all-volunteer organization. as well as wilfus.org under the Cuba campaign. And so, but as well as that work, we just also want to leave you, as Bob said, this is an action workshop, and there are 2 bills in Congress that we want you to lobby your congressional representative. House Bill 7521 and Senate Bill 136, both aimed at lifting the trade embargo and normalizing relations with Cuba. It may seem that this is not possible at this time, but if your voices and the voices of your neighbors and everybody that you come in contact their congressional representatives, we may have a chance of lifting some of the opponents of the blockade, telling Trump that we will not stand for the oil embargo and the sanctions that he's put against other nations, and that we want U.S. policy towards Cuba changed today. So we really need your help. Pardon?
Could you repeat the bill again?
H.R. 7521.
In the House.
That's the House, and in the Senate, Senate Bill 136. And then lastly, travel to Cuba now. There are lots of delegations going. It's important, especially in this period, to keep going. And we recommend you go in delegations because of the oil crisis. It's difficult to travel just on your own, and it makes more impact if you travel in a delegation. Pardon?
I said take mosquito repellent. But what I really wanted to say is, even though it's not just about donating money, it's good to donate money. And if you, like me, are a checkbook dinosaur, don't put Cuba on the check.
Right.
Right.
The best is cash.
Cash is awesome.
All right. So those are, go ahead.
Can I ask a quick question?
Sure.
Yeah, good afternoon. My name is Asantwa Nkrumah. I'm about to be a member of Philly for Cuba in Philadelphia, Pennsylvania, and it would be remiss to lead such a conference. As a woman of African descent, I want to give my utmost thanks to all the people of Cuba for giving asylum to our dear sister, but we will thank you forever.
Okay, time to close this. I want to thank the Federation of Cuban Women. Osmaida's still here. Thank you so much. And please, take up the campaign. That's why you're here today.